All right. So for anyone that doesn't know me, thank you very much for coming today. My name is Abby Conger, and I'm with the Bureau of Developmental Services. And my role here at the Bureau is Employment, Self-Direction, and Other Strategic Initiatives Administrator. We're here today to go over about a 1-hour training around the provider enrollment process. And we did have a 2-hour training previously that's posted on our website. We had another one of these 1-hour sessions 2 weeks ago, and then this is our second one of this series. So we're excited that you're all here to learn more about the provider enrollment process, and I'm going to go ahead and pass it over to Stephanie to introduce herself as a partner in this with us. And then Stephanie, if you want to pass it on to the next person, maybe Kathleen, that would be great. Oop, you're on mute.
Of course I am. I always am like, it's not going to be me this meeting that's on mute.
But it was.
I'm Stephanie Ellis, and I am the provider enrollment unit administrator here at the state. And I'm excited to have you guys have the opportunity to come on board and be Medicaid providers. And I'm going to pass it on over to Kathleen.
Hey, I was on mute too. This is Kathleen. I am the provider relations manager here at Conduit, and in that capacity, we have enrollment and provider field reps. And I look forward to working with you all. And thank you.
Great. Great. I'm going to go ahead and share my screen again. Make sure, can everyone see the presentation okay? Great, all right. So again, we're here to talk about becoming a Medicaid enrolled provider in New Hampshire. I'm going to go through a few slides and just do kind of a quick overview of why we're doing this, what the process looks like, and then I will pass it over to Stephanie again, and she'll go more into detail about the actual process of applying. Okay. So to start, so this is the direct bill requirement that we have through CMS, so the Department of Health and Human Services and the Bureau of Developmental Services has been working to become compliant with the Center for Medicare and Medicaid Services CMS regulation. And this includes conflict-free case management as well as the direct bill requirements. So at this point, as many of you know, currently the New Hampshire system is the billing is done through our 10 area agency system. And starting on 7/1 of 23, we will have the ability for all providers in New Hampshire to bill Medicaid directly if they wish. Now, everybody must enroll to be a developmental services provider, but you do not have to be the one that's billing Medicaid directly for those services, but you do need to enroll. We just need to be able to give you the option to bill directly if you would wish to. So again, per our CMS regulations, providers must have the option to bill for the services through the state Medicaid management system, also known as MMIS, or they can use a third-party biller, such as an area agency or another financial entity. Now, for that third-party biller, that is another book of business that is not an area agency function, and it may be something as a private provider you choose to do as another book of business. And that is referred to throughout this presentation as a trading partner. And so there is another separate application process to be a trading partner as well. And we can talk about that more if we need to as well. So again, providers need to have the opportunity to bill, but they're not going to be required to do so. And that begins on 7/1 of 23. And that is under the DD, ABD, and in-home supports waiver. So here we have a nice little graphic just to kind of help walk through this process about provider enrollment. So the first question you're asking as a provider, are you going to be a provider of developmental services or do you wish to become one? The answer to that is yes. Then you need to submit an application to become a developmental services provider in New Hampshire in the MMIS portal. Next is, do you want to bill directly through Medicaid? If your answer is yes, you're the provider of the services in New Hampshire, you can choose to bill through the MMIS portal directly. You may be using a third-party software to bill, and then you'll be able to be paid for those Medicaid services provided. Should you wish to be an enrolled Medicaid provider of the service, but you do not want to bill directly, provider would then contract with an authorized third-party billing entity to bill on behalf. That authorized third-party biller must submit an application to be a trading partner unless they are already enrolled as a trading partner. That entity would know if they're already enrolled as a trading partner. They would have a 7-digit billing number that would start with an NH. So if they have that NH and then the 7 digits after that, they have that trading partner ID that you as a provider will need to include on your application when you submit to be a developmental services provider, and you're indicating that you're going to have this third-party bill on your behalf. From there, the provider gets paid through the services through this third-party biller. Again, this is just kind of a quick, nice little graphic, and this will be available again on the website for you to refer to kind of see that process flow. This is our kind of high-level anticipated timeline for processing provider enrollment applications. So you'll see through the month of September and October, we've offered the 2 educational webinars for provider enrollment, with our goal that all providers in New Hampshire will submit their applications to be a developmental services provider by December 31st of 22. Between now and that time, providers, if you haven't already submitted an application, please do so. If you haven't submitted your trading partner application and you would like to, please do that as well. And then if you have any changes that you need to make to an existing application you've already submitted, this is still also your time to do that. We do realize there's a number of applications that have been submitted over the last year or two that we're going to begin processing and working through, but we really need to have all applications submitted by the end of December to allow us to have time to go through all those applications in order to make all providers ready for a go live date for billing of 7/1/23. Now, private providers right now that are not currently enrolled, those applications will be prioritized. Our area agency system, as they continue to re-enroll as developmental services providers, those applications will get processed last. So we'll be looking at probably sometime around March and April, maybe even into early May, that we'll start processing the area agency applications. The priority right now is really those providers that aren't known to the system at this time. Okay. So again, if providers are not enrolled by the time of 7/1, then this could be a direct impact in timing on payment for the services that you're providing. So it's very, very crucial that you get that application in, allow the time for processing so that you are ready for that 7/1/23 go live date. We do have multiple departments, multiple teams working to ensure that this is a smooth transition. So again, the sooner we get those applications, the smoother the transition can be for your entity. Going to go ahead and pass it over to Stephanie now for how providers enroll for direct bill. We do a few more slides and we will give time for questioning, but I just wanted to kind of get through that quick high level so that we could really get into the information around the actual enrollment.
Right. That's good information. Good information, Abby. Good information. Okay, so you've decided you want to be a provider for Medicaid. So what do we have to do? How are we going to get you enrolled? So our first step is we have to access the application on the New Hampshire MMIS portal. In order to do that, you can search Google and type in New Hampshire MMIS provider portal. It should bring you up to the website, or you can go to https nhmmis.nh.gov, and it'll bring you up to the page where you can enroll. There'll be a little sidebar that'll say quick links and enrollment, and you want to go in there and choose the application that you need and follow the instructions and enroll. yourself there. To complete the application, we're gonna need a little bit of information from you. So we're gonna need a signed provider participation agreement, also known as the PPA. It's a little contract with the state, signed application signature page. Licensure, if it's required, we'll need it, but I believe that you guys are being licensed after the fact, so you need to just make sure that you keep it on hand if we were to need it. Is that correct, Abby? Right.
Yeah, so for most of the services that are under the developmental service system, providers would receive a license or certification from Peter Bacon and his team under licensing and certification. And that typically happens after you've been enrolled as a Medicaid provider. So when you have an identified individual, maybe moving into a residential home, or into a home care provider, and you need to get it certified. So at that point, you would already be an enrolled Medicaid provider. So in most cases, you will not be required to have any kind of a license or certification on file for this process. However, you must keep them upon audit, either from us at BDS or from program integrity at any time.
You'll need a copy of a signed W-9. You'll need your FEIN, IRS verification letter or social security number verification, and NPI verification if we require it. If we don't have the information that we need, it holds up the application approval process a little bit. So if we're reaching out, just keep an eye on your inbox to see if you receive anything from us, and we can get that communication going and get you enrolled as quickly as we can. And please include your email address on the application so that we can contact you and make this a little bit easier on you. Our next thing is you got to decide how you want to bill for services, as Abby was talking about previously. You have to decide if we want to bill through MMIS directly in the portal, which it would be direct billing. So you would be doing all of your claims uploading, you would be doing all of that type of stuff. That way, you have to decide if you want to go through a third-party software where the provider is responsible for utilizing that software into the MMIS, but you're using a software that's deployed on your laptop or your computer, and you would use their software to get your information into the MMIS, or through a third-party biller. The third-party biller will need to fill out your trading partner application, and both applications will have to indicate the trading partner agreement number. So like Abby was saying before, if you have a trading partner, they'll have that NH and then the 7 digits afterwards. If that's, we would have to indicate that on the application so that we can link you together, so we know who is doing your billing that way. The next slide, please.
Yep, I was going to go ahead and take this one. Yep. So as I said, we had a number of applications over the last year and a half or so that have already been submitted. And one of the things that we just wanted to add, and this is new information even from our last presentation. So I just want to point out that this is an additional slide, and so that will be the information on the website once we get it posted. But there is a section on the application, and I'm going to look to a different screen where it's bigger. So I apologize for not looking directly at you all, where you're selecting the provider type. So your developmental services group. And then there's a section for you to grab the specialties and add the specialties. And you'll see there on the drop down, those are the different services offered under the waivers, ABD, DD, and in-home support. Now, some of those services, for example, residential habilitation, which you'll see the specialty code 510 for. That is typically when we hear residential habilitation, we think of our DD and ABD waiver. That is also including in-home supports, which is our in-home residential habilitation service. So we wanted to include this chart so that if you were looking, thinking, gosh, the in-home support one's not listed here, it is the residential habilitation code is all encompassing of all 3 of those waivers. So it's going to be really important that if you've not already done your application, when you go to do your application, you get to the specialties, you add each specialty that you would like to bill Medicaid for. So you want to be a registered Medicaid provider of assistive technology, of community participation services. Maybe you don't want to for community support services, but it's going to be important that you add each one of those specialties to your application. For applications that were already previously submitted, and this may or may not have been done, somebody from the provider enrollment team will be reaching out to whoever submitted the application directly to confirm this information so that in the system we can update that and get the application pushed through and finished processing. Stephanie, I'm going to hand it back to you for the NPI number.
All right. Okay, so we need our national provider identification NPI. Some specialties require an NPI to register as a Medicaid provider. All individuals and organizations that meet the definition of a healthcare provider as described at 45 CFR 160.103. There will be a test later, just so you guys know those. Just kidding. Are eligible to obtain an NPI. These include health plans, health plan clearinghouses, healthcare providers who transmit health information electronically, and healthcare organizations that transmit protected health information to covered entities who require access to the protected health information. That's a lot. To obtain an NPI, an individual or an organization must submit an application to the National Plan and Provider Enumeration Service System, or as we like to call it, NPES, NPPES. Obtain an NPI or check if you have an NPI at the website we have listed here, which is https://npiregistry.cms.hhs.gov.
So our next slide is going to talk about the next steps after your application has been submitted. So I think that this is probably a good time to pause, and I'd be happy to go back to any slides if people have questions. But are there any questions about, again, we're going to go into after you've applied, but the application process and anything we've talked about so far? I think that there's things that have come into the chat. So let me just pull that up. If a trading partner is used, does the cash end up with the trading partner first and then must be distributed to the provider, or is the provider paid directly? I believe the answer to that is the provider is paid directly, but anyone from Conduit, Kathleen, could you confirm that? Is that accurate?
Could you say that question again, please?
Yep, if an entity is choosing to use a trading partner, is that, and they bill, the trading partner bills on that provider's behalf, when the money gets paid out, does it go back to the trading partner and then the trading partner is responsible for paying that provider, or does that money go directly to the provider?
That money goes to the provider.
I thought so. I just wanted to make sure. Great. Okay, is the Medicaid
I should
enrollment?
clarify that to say
Yeah.
that that money goes to whomever they've set up payments for in their enrollment.
Perfect, thank you. Is the Medicaid enrollment application the same thing as a trading partner application? So no, it is not. So the Medicaid enrollment application that we're talking about today is to be a enrolled provider of services under the developmental service system. In addition to that, and if you want to direct bill for your own entity, then yes, that's the Medicaid enrollment application. If you're not going to be the one direct billing and you're going to have a third party bill or a trading partner apply bill on your behalf, that trading partner then needs to submit an application. So it is two separate application processes. And same thing, if you as one entity are looking to do both books of business, you are going to want to do a Medicaid enrollment application to be the service provider. And then you're going to want to do a trading partner application if you plan on billing on behalf of other businesses. Okay. Does this training apply to early supports and services? At this time, we're only talking about the ABD waiver, DD waiver, and in-home supports. This is not applying to early supports and services at this time. So there is a question kind of / comment in the chat. So this organization is working with multiple area agencies and we plan for them to continue to do our billing. Will we need a trading partner agreement with each one of them? So as a Medicaid enrolled provider, you can only have one trading partner. You cannot have multiple trading partners. So you'll need to essentially shop around and decide what area agency, if they're looking to entertain that as a continued book of business, which we haven't heard that any are not, but still I would encourage you to talk to the multiple agencies that you work with, and you would have one trading partner. So all your billing would be done through that one entity. You would not have multiple agencies billing on your behalf. On the landing page for enrollment, it presents two avenues: becoming a billing provider and becoming a non-billing provider. If we intend to use a trading partner for billing, do we still follow the becoming a billing provider process? Stephanie, could you take that one?
Sorry, it was on mute. I didn't, what question was that? I'm sorry. I'm looking in the chat, but I didn't see it.
That's okay. I think this one just came to me. So on the landing page for enrollment, there's two options: becoming a billing provider and becoming a non-billing provider. Even if we intend to use a trading partner for billing, do we still follow the becoming a billing provider process? Kathleen shaking her head saying yes, so I'm thinking that
I was like,
on there.
You want to definitely become a billing provider, select group provider enrollment, because you're enrolling as a group.
All right. So the next question is, do we check off specialties such as wellness coaching if we are including it in people's budgets, but then subcontract out the service? Yes, because you are the billing servicing provider. So the money is coming to you. You're essentially overseeing that service. If you're then subcontracting that out to the person providing that direct service, that's what your business is doing. But yes, you will need to select a specialty on any specialty that your agency or your as a private provider will be providing to that individual, whether you're keeping it in-house or then contracting it out.
Thank you.
Yes. Okay. What happens if the area agency has applied to be a trading partner, but has not heard back from Medicaid on their status? So as far as I know at this point, we are going to be continuing to review applications as they come in. We're going to be looking at those trading partner applications and working through them as quickly as possible as they're coming in, so that we can get that information out to you. But that's why we're trying to communicate now and put the message out there that if area agencies or any private providers wish to open that book of business and become a trading partner, that they get those applications in as soon as possible, so then we can get them processed and be able to get that information back out to those trading partners, so then they can distribute it to you as a developmental services provider, so you can complete your application. And again, we aren't going to have all applications for developmental services processed by 12/31. That's why we're giving that as our target deadline for the applications to be submitted, which would then give us the ability to have the time from, January to, I'd like to say May, to get through all applications submitted and if there's any missing information. Where do we find the trading partner application? I believe that's also on the same website as the provider enrollment. Should be right there, I believe.
So it's the third blue square down on the left side, become a trading partner. And there's a trading partner enrollment right there.
Okay. So the next question is trading partner software choices. So again, we've got a trading partner, and then you can use a third-party software. So you have three different ways that you can do direct bill. Direct bill yourself, use a trading partner, or use that third-party software. So this this comment is, we did not have a third-party software picked when we sent in our application. If we choose a provider, I might butcher this, Therap to process our billing, how do we add this to our application? So you should be able to go in and edit your application. You might submit your application within the next month and say you're going to direct bill yourselves. And then in 4 months from now, you could say, we aren't going to be able to do that. We are actually going to have a trading partner. You can go in and make that change at any time. It's not something that you're locked into once you submit it. Just know that it is a change in your application. And as we're going to be working through applications, it could just, no, I don't want to say hold up the process, but you're changing something that you've already started. So, but you're not locked into whatever you've selected.
I'm sorry, I'm just going to piggyback on that and say that once you've submitted your application, you can no longer make changes on that application form because it's no longer on your side, it's submitted. You just have to contact Conduent and call the call center. If nobody on the Conduent side has contacted you from the provider enrollment side, then just call the call center and let them know what you need to do.
Great. And I think that helps answer our next question too, is how do we edit an application that has been submitted? And on MMIS, it indicates the application is still in process. So exactly that. And we do have that contact information at the end of this slide too for you at slideshow. Okay. So the next question is, I hear that you say you will need to have a trading partner number when you apply. What is the DNT have their number yet? What if they don't have their number yet? So exactly that. So we need to get those trading partner applications submitted. We need to get them approved. So that way other businesses that are looking to submit just their direct bill developmental services provider application can have that trading partner number listed. So when they apply to be a developmental services provider, they have to select how they plan to bill. So if they're planning on using that third-party biller, then they need to wait until they have that number so that we can link that and process that application. Okay, we have another question about someone has previously submitted their application. However, they need to make some edits. And so how are they able to do that? Again, we'll have that contact information at the end of this presentation, and you'll be able to email or call and work through some of those changes. The organization has contracts with 2 New Hampshire agencies to provide services. We are making the application, or are the New Hampshire agencies applying? Mary, I don't know if you want to elaborate a little bit more on your question. If you're the service provider, then you will need to apply. I don't know what you're saying. The 2 New Hampshire agencies are billing on your behalf. You would need to select one agency to bill on your behalf as the trading partner, but you would need to apply to be a Medicaid provider. If I didn't answer your question, you can go ahead, jump off mute. We have enough. So going back to the landing page question, did you say that even if we intend to use a trading partner, we still apply as a billing provider? Shouldn't we then apply as a non-billing provider? I'll defer to either Stephanie or Kathleen, but I'm going to say that you still have to apply as a billing provider, because at any point in time, you could make the decision to bill on your own and not use that third-party biller software or trading partner. And we have to give you the option to bill. So we can't have you enroll as a non-billing provider when it's our requirement to give you that option to bill at any time.
If it's helpful to think about, you are enrolling New Hampshire Medicaid. So you're the group provider enrolling in New Hampshire Medicaid. How you bill New Hampshire Medicaid is a separate aspect of that. So the trading partner who is going to submit claims for you they need to be enrolled as well so that they can speak to New Hampshire Medicaid system, MMIS, and they need to be identified on your application. I don't know if that's.
Thanks. All right, so we have multiple contracts for multiple locations, and we contract with all of the New Hampshire area agencies. Our application was submitted in 2021, and they are still in process. Should we expect for these to be completed soon? So as I said, we have got a number of applications that have been submitted over the last year and a half. We're continuing to start processing those, and we'll be looking at them between now and March. Primary focus right now is getting providers that have not already enrolled by that deadline, but we are starting to continue to work through those applications previously submitted. As I had also said, those previous applications submitted potentially did not select the specialties or the full array of services that they wish to provide. So you will be hearing from somebody from provider enrollment confirming the specialties that you would like to be enrolled in. So that will be probably our main focus over the next 3 months in regards to the applications already previously submitted versus new applications coming in. Please, please, please make sure you select the specialties that you are looking for. All right. How do we complete the trading partner application without the ability to complete the trading partner agreement signature page, because we don't know who might want to use us as a trading partner? It asks you to list all of your partners.
So you're right. On the trading partner application, you need to indicate a provider that you're going to be a trading partner for. You have to have at least one provider identified. In the situation where the provider is not yet enrolled, you can reference their application tracking number or their NPI number if they require an NPI number. You can indicate something other than the actual provider ID, and we'll take that to help process the application.
Excuse me, I'm sorry. That was my question.
Yeah.
So I guess my confusion is, don't they have to have our trading partner number also? So don't we have to have each other's numbers to do this? So if we don't have a number.
Right. One has to come before the other, though. And in this instance, we need the trading partner to come first because we need you to be enrolled so that you can give
Right.
those numbers to
So how do you
your
complete?
number to the provider.
So can you complete the trading partner application to become the person who submits the billing without someone who's asked you yet, because they don't have a number to, do you see what I'm saying? So which comes first here? If we want to be a trading partner or want to be available to our vendors to do that for them, but we don't know yet who might want to use us, and they need our number, and we can't complete the application without a person, but they haven't submitted their application yet. How do we get ahead of that?
Can I just say one thing, because I just did it? I was able to complete the application without adding somebody. And
Okay,
on the signature page, it's asking for us as the trading partner. And the only number I see is the application tracking number that they gave us that they're looking for.
okay, great, thank you.
Thanks, Tanya. All right. If we went ahead and submitted a non-billing provider application, should we request an edit or should we submit a new application as a billing provider application?
If you have, I'm sorry, I'll take that. If
I
you
figured.
submitted a non-billing application, it will need to be canceled and you need to do a billing application. We'll preview all the applications, get all the information that we know is required before they go over to the state. And you will be identified if you are that you don't have the correct application. And you'll be asked to resubmit under a new group provider enrollment. Do you happen to know that you did that? Because if you have your ATN, I can have that taken and canceled so you can resubmit, and you can resubmit as a provider, group provider. Okay,
All right, so that is all the questions in the chat. I don't think I see any hands raised, so we're gonna go ahead and move on to the next slide, which is the next steps after application submission. The hands-
oh, that's me.
Kathleen?
I'm sorry.
Yeah, go ahead.
Okay, so after you've submitted your application, you will get it, so it gets reviewed and processed, and if there's anything missing or needed from it, we'll reach out to you to gain that information, whether it's a form or information. The state will tell us that, yes, we're approving these applications, and what we'll do is complete them. And you'll get a welcome letter from New Hampshire DHHS via the US mail. So it's important that your addresses are current and up to date. So if you submitted your application a year ago and you know you've moved, or you want your mail to go somewhere else, again, reach out to Conduent, let us know, so fix the address in the system for you. And then your welcome letter will have an effective date of when you are actually approved and enrolled. However, can't bill against these codes until
Go lie down.
7/1.
Go lie down.
Sorry. Do you have a question? Okay. If there are issues or questions with the application and billing preferences, a representative Conduent will contact you. So there are, a number of applications that have been submitted and have not yet been approved to get you that welcome letter. But we can reach out to you. We'll reach out to you to find out if you do in fact want to change your billing preferences. So the ones that are pending right now, if you want to change to third party or to a trading partner, or prefer to stay as direct billing. And the two people that will be reaching out will be identified at the end here, their contact information as well. Okay. And you will have access to the MMIS portal once you're approved. And in that MMIS portal, you'll be able to check eligibility, be able to submit claims, be able to do adjustments if you need to do adjustments. There's a lot of information that will happen there. So you'll also get a separate welcome email from Conduent that will tell you the different things that are available to you and to set up individual training if needed, and who to contact with questions. Okay.
So again, just some important reminders that we are looking for all applications to be submitted by 12/31/22 in order to provide for processing. Providers will need to keep all necessary certification and licenses to present for an audit if needed. So that's part of that certification and licensing that we talked about, that it is not needed to apply to be an enrolled Medicaid provider, but please have it available upon audit, whether again, it's through BDS, through our service file reviews, through program integrity, or any other entity that may be coming in to do that audit. Providers will not be able to bill directly until 7/1/23 dates of service, regardless of the date that they received that welcome letter. So Kathleen just talked about that you will get, your welcome letter, it'll have a date that you're active, but you cannot bill until that 7/1/23 date for services provided 7/1/23 and beyond. Area agency applications again will be processed last, and that's the area agency is the developmental services piece, not the trading partner piece, because I want to be clear that again, that is two different processes, two different applications. So we will be processing the developmental services piece last, not trading partners if an agency does choose to submit those. And that's to help us align with the administrative work, and that the agencies will be continuing to bill up through 6/30. Some additional resources that we have here for you is our BDS website. So again, we do have a section for our systems work, and we will be continuing to update that with provider enrollment information. This presentation will be posted on there, as well as the recorded webinar. And the previous training, the 2-hour long that goes a little bit more in depth, that was done, said it was either last year or the year before, that is currently up on the website that you can review now. And we will be updating our FAQ document based off of questions that you all had today, and that will also get posted. There's also the New Hampshire MMS website as a resource through provider enrollment. And then within this presentation, we do have a number of appendices that offer a little bit more in-depth information about what we discussed today. And then for any questions on your application, you can contact New Hampshire Medicaid Provider Relations. There is the call center number with their hours, as well as the email address. And again, just one last time, that all provider applications for enrollment are due by 12/31. Right. So we do have a number of more questions that have come into the chat, and we want to make sure that we open it up if people raise their hand, have more questions, but I'm going to go through the chat again really quick, and then we can answer any questions that all of you might have. So the question that have come in. So just to confirm, a non-billing application is one that continues to bill through the New Hampshire area agencies, correct? And the billing one is the one that bills MDCD directly.
No,
No, Abby, this is Karen.
Thanks, Karen. I was gonna say if someone wanted to hop in on that one.
Yeah. Okay, every single provider providing a service in the community or residents or wherever must enroll as a group provider. You are not individual billing, non-billing. No, you are a group billing provider. So that way, no matter how you choose that you're going to proceed with your billing of claims is different than enrollment. There's two separate entities going on. You have to be enrolled as a Medicaid provider, and it's a group billing provider. That's what you use, okay? Because I know you're all providing services and you're currently getting paid for those services. It's just the mechanism is just going to be a little bit different going forward.
Great. Thank you very much, Karen.
You're welcome.
Can anyone give me a sense of time on how long it takes to complete an application? I can say that I have not completed an application, so I don't think I could give you that. But if there's anyone here that would like to jump off mute to help give an idea of how long it took, that would be very helpful.
Well, I've done one, and if you have all your information in front of you, you have your NPI number, you have your specialties, you know exactly what you're going to do. You have your pages printed off so you can have signatures, or you're going to do electronic signatures. You should be able to sit down and do an application in like less than a couple hours. It shouldn't take you long, but I give a couple hours because that way you have time to go through the screens and read them. So it's not that involved. It's just the pieces of information you have to have. Remember, you have to have that NPI number first. So if you do not have an NPI number, you should start that process before you even start our application. That will give you a jump.
Great, thank you.
Mm-hmm.
We completed our application by the original deadline in 2021, and we have been enrolled. Do we need to start again, as we are not planning on direct billing? If you've already enrolled and you received your letter from Conduent that you are an enrolled New Hampshire Medicaid provider of developmental services, no. If you've not received your approval letter, then I wouldn't. I would suspect that it's still in process and that it is not. It has not. You've not fully been enrolled. But if you've already received your letter, then no, you would not need to reapply again, as long as none of the information within your original application that was approved has changed.
So we can reach out. I'll have someone reach out to Robert and go over his what's in the system so that he knows what needs to be changed, be updated or changed.
Okay. Thanks, Kathleen.
Right.
So this is Karen again, Abby. I just want to do a clarification on all the
Sure.
questions about trading partner, okay?
Sure.
You can have more than one trading partner. You can only have one that receives your 834 file. So if you are using multiple agencies now, you can continue that, but only one of them is going to get your 834 file. And Kathleen, can you please tell them what the 834 file is?
They'll get an 835. And
835,
that's,
sorry.
no problem. And that's their reply to, the 835 is what they will send. Sorry, start again. So there are remittance advices in 835s. And if you have a trading partner and you are using a third party to submit your claims, they will receive the 835 return information. And it's an electronic file that they receive. You will still get your remittance advice, your RAs in your portal. They'll still be available to you. But in order for them to reconcile what they've submitted for you and has been processed on your behalf, they have to get a reply file. That's the 835 file.
Karen, thank you for that clarification. So if there are entities out there that are going to be looking to use multiple trading partners, then I would suggest that you contact, would it be provider relations, or who would be our best contact to direct these providers to ask questions on that for them to help make the decision if that's what's going to be best for them. It just sounds like there's a little bit of an extra step, an extra layer if you are
Yes.
using multiple trading partners. And not sure if that's typically common or if it's more common to have the one billing on your behalf. But I just want to make sure that
Yeah.
we include some resources for providers to explore what's going to be best for them.
So I think if they're submitting an app and they're not sure how to do it for multiple trading partners, you need to reach out to Provider Relations at Conduit, okay? If you've already submitted an app and you're making a decision that you want to use multiple trading partners, please still reach out to Conduit Provider Relations. Because remember, the apps have been sitting, okay? I see plenty of questions coming through. But the apps have been sitting and waiting for all of this to be finalized with all these multiple steps that we've had to go through for your provider type. So I would suggest if you have any questions and you know you've submitted it and you want to make any changes, you're going to reach out to Provider Relations at Conduit. Someone's asking for the phone number, and I think, Abby, can you go back?
Yes,
Did you have it on the screen? There you go.
There we go.
So that's the call center. That's the number you want to use, okay, for the provider contact, for anything to do with your applications, whether you're starting them, don't know how to fill out multiple trading partners, or you have one that's been sitting and waiting and you want to make changes to it. That's where you first start. Don't worry about the specialties right now. We're going to be reaching out to everybody between program integrity and provider enrollment. Both sides of the house is going to start reaching out. We're going to be sending emails. So watch your email box. We're going to start asking you to tell us what specialties you want to provide. So have that specialty list handy. I don't know, Abby, if that can be sent out ahead of time. The specialty list.
The specialty list.
Yes.
I'm sure we could either send it out to in an email blast, or it'll
Okay.
certainly be, this presentation will be posted on the website, so people can
Mhm.
absolutely refer to this as well.
Yeah,
So yes, so there is, I just kind of quickly went through some of the remaining questions. There's a couple of questions and related to people that have already submitted their applications. So as we kind of showed our timeline and said again, that we know we've got a year and a half now. People have been submitting applications, we have them, we know that they're sitting, and we will be beginning to process those. And if you've already submitted your application and it did not have specialties assigned to it, we will be reaching out to you and asking about those specialties so that we can get those applications processed. So we have them. If you have concerns about where your application is within the process, or you have questions, please feel free to reach out to the phone number or the email address listed here. And same thing, if you had an application that you know is in process, but now you need to make changes, please reach out to this email address or phone number to get those changes updated. And then we do have a couple more questions that have come in specifically around trading partner and using multiple trading partners. I think Karen kind of just answered those questions. That it is doable to have more than one trading partner billing on your behalf. However, one trading partner will receive that 835 or 834 that you said, Kathleen. So you're going to want to just, I think, look what's best for your business and as a provider, and if you wish to have multiple or have the one. And again, it's another book of business for a trading partner, so to shop around as to what is going to work best for you. Couple requests for the email and phone number, so we do have those up on the screen again. Just to confirm, a group billing provider, is that still on the same landing page as the application, or is that a separate enrollment? I believe it would be on.
So it's under the section says for enrollment. If you go, the first one, it's a become a billing provider. The group provider enrollment blue hyperlink is what you're going to click on in order to fill out the correct application. So you want to fill out the group provider enrollment application.
Great. And can you start filling out an application partially and then go back in, or does it all have to be filled in at one time?
You can. And again, it's in the same page that you go to provider enrollment, and it's the right side of the application of the documents. You'll see application status, recall provider application. Under recall provider application, that's where you're going to put in your provider's tracking number that you got when you started it and your FEIN. And that will recall it and go ahead and continue that application. If you didn't record your application number when you were doing it, you can give the call center a call and see if they can retrieve it for you. Depending on, it has to be exact, but it's better if you've gone halfway through it to just give a call so we can recall it for you instead of starting all over.
Oh, perfect. And Stephanie just added that link for the enrollment page in the chat for everybody too. So save that.
That would be good for everybody to see it too.
So, all right, so we have a comment here. Someone just tried calling the phone number provided, and it doesn't say if you're checking on an application, press whatever number. It only gives you two choices, and neither one of them are about checking on an application.
Just stay on the line and it will get connected to it. We don't say all the different things you can ask about. It'll go to the call center. Just stay on the line.
Thank you.
Get a live person. You're welcome.
So looking through the chat, I think we've hit all the questions. And again, there was multiple questions about I've already submitted my application or trading partner. So I didn't read each individual one, but I do think we've covered all of the questions. We've got about 6 minutes left, so if there's any additional questions, anyone feel free to put a hand up, put it in the chat, come off mute.
Will there be training provided on how to do the billing?
I did miss that one, Deb. I'm sorry. I did see it and I was like, oh, gotta get back to that one.
Thank you.
So that is something that we are currently discussing, and we will be looking into that to see how we can offer that to providers. Yes,
Thank you.
yes. So. Will we need updated taxonomy letter numbers to go with new service codes? I don't know.
This is Karen. Yes, you will.
Thank you, Karen.
If you're adding new services, you have to do a new taxonomy or add it to your current taxonomy. Yes.
Do you need an NPI number if we are using a trading partner?
Yes, you do. All group providers need an NPI unless you fall outside of the category of getting an NPI. So read the NPI information on the NPES website. It has a whole fact sheet there and you can actually walk through it. But if you're exchanging PHI with a trading partner, you need an NPI.
Don't see anyone's hand raised. I don't see any new questions in the chat. We do still have 4 minutes. We'll certainly stay on, but for anyone that hops off, I want to thank you very much for coming today. And again, we'll get all this information posted on the website. Please feel free to reach out to provider relations, reach out to Conduent, or certainly if you have questions, maybe more specifically around the services piece, feel free to reach out to me. But questions on your application, you're definitely going to want to go through provider relations and Conduent. But again, we really appreciate everyone's attention to this. And I'll just throw our deadline out one more time of December 31st of 22 for applications to be submitted to ensure for processing for a go live date of 7/1 of 23. Thank you, everybody. Still checking. I don't have any new questions that have come into the chat. Got about a minute left, so if there is anyone still, I mean, feel free to come right off mute if you have any other questions. I don't want to end this because it'll cut everybody off, so we'll certainly stay on right till 10. Right. Is a New Hampshire assigned ID number different than the NPI number? I think the answer is yes to that.
Yes,
Yes, thank you.
and, yes.
Great. All right, well, that brings us, I've been saying 10, but it's 11, so that brings us to 11 o'clock. So I'm gonna go ahead and stop the share and end our presentation today. So again, thank you very much, and please feel free to reach out with questions. Thanks, everybody.